Okay, good morning, my dear friends. So you're going to see a very interesting case of adenocarcinoma of the paranasal sinuses. Of course, it's not a big case, a small case, but it has got a big lot of significance. Why has it got significance? I'll tell you why. Now, this patient presented to me around 8 years back. 8 years back, and 2000. So she will. I will just share the screen. Desktop. Yeah. Let's hear to what she's saying. Yeah, pure money. Okay, the reason why I posted this video to you is because the patient was operated by me 8 years back. Adenocarcinoma, extensive adenocarcinoma paranasal sinuses operated 8 years back. And now the patient has got a recurrence after 8 years for the past 2 months. So that means the prognosis for adenocarcinoma, if done properly, is depends on the grade also. Mild, moderate, and severe. This patient had moderate grade of adenocarcinoma of the paranasal sinuses. I did a wide resection, and the patient is all right for the past 8 years. Now she has developed a small recurrence. So these tumors usually come in woodworkers. So the patient also had exposure to wood. She was also going to some, the construction companies and all. So we did a PET scan, and you can see here the PET scan. I'm going to show you the PET, how the PET looks like in this case. Get it away. Here. So the patient has got a very small lesion. Huh? 3. Now I'm going to share my screen and I want to discuss the scans with you. Now you see here, this is the latest scan. Of course, the previous scan 8 years back, she doesn't have. But I have the surgery on record because I record all my surgeries as I know. So we have resected you can see here the resection margins, completely resected. But now she's got some sinusitis here in the sphenoid sinus, a little bit in the sphenoid and the maxillary sinus. And she's got a small recurrence here. So that was found out by a PET scan. Now let me show you the PET scan. Here is the film here. And you can see that's the recurrence here. You can see a small tumor, which we are going to resect. So whenever you suspect a tumor, if the patient has epistaxis or anything like that, immediately take a PET scan. So that will definitely give you the correct site of the lesion and what to do. So we are just going to do a wide surgical resection. And I think we'll have to follow this patient again with a dose of gamma knife. So that is what we are planning to do. So we're going to start this case. And once I start it, I will get back to you. Have you intubated the patient? Huh? Okay, get ready. So we have, next case we have is a Jarjaway fracture. And I'm going to show you how to reduce the close reduction of the nasal bone fracture. What is my technique? And then we have a SHILPEE surgery. So all interesting cases lined up. Let me share. How we share? Share பண்ணி sir, all groups. Celebrating the Republic Day, that is by teaching. So anything you do noble, you celebrate a Republic Day. That's it. Okay, now we're almost ready. For wash up, I'll be back with you. Okay, so we are going to start the case. Small case, but to convey a point that adenocarcinoma, low grade, if you excise it properly, has got a very good prognosis. Of course, it doesn't respond to radiotherapy, as we all know. Now I'm going to show you the finding. I have operated this patient. You can see. See, that's the surgical cavity. You can see here that we have resected the nasopharynx. Sphenoid is filled with pus. And that's the lesion here. This is the lesion. You can see that pus in the maxillary sinus as well. Lights off. Okay, I'm now going to start with treatment of the sinusitis first. So I'll open up the, why is it like this, man? Why? Give me the sphenoid probe. See the pus there. So I'm now going to open up the sphenoid sinus. See, that's the sphenoid sinus. I've opened it. Now give me a Blakeslee. Use the Blakeslee. Once I open the sphenoid sinus, go inside, use the Blakeslee. And then just open it. See that you have fungus, I think. Yeah. Suction, please. Suction. Suction, please. See the fungus there. Debrida. Debrida. Hey, why is this dull, man? No. Why you can't see all that, Shiva, before? Huh? Why is it dull? Huh? Light increase. Shiva, you have to see all this, Shiva. You have already become old. You cannot depend on 10 people. Oh. So we're opening up the sphenoid sinus wide. Give me the irrigation. So I'm going to irrigate that sphenoid sinus. Not this. Hey, straight kudra. Straight. Kudu. Hold that, this one. Ready? Shall I irrigate? Hey, don't press. Suction. See the fungus. This is just fungal ball. Don't send it for anything. Culture and all not necessary. So the first step was to take off the fungus from the sphenoid sinus. So that is it. Finished. Now I'm going to start with the lesion. See here, that is a lesion. You understand? Now give me the coblation. I'm going to take a good margin. The main thing is try to take, if it is in the nasal cavity, you can take a margin. If it is in the brain, you can't. You understand? So see here, now that's the uncinate process. and it is almost on the nasolacrimal duct. So I have to do something like a DCR. You get my point? See that? You see that? That is the mass. Elevator. Now I'm going to take off that mass with the elevator. See here. See, that is the mass. Can you see? Now what I'll do is I'll try to remove this bone along with that mass. This is what is called sequential layer resection. It's called means you go one step above. You get my point? So any malignancy, inverted papilloma, this is the treatment of choice. You understand? See, this is the mass, and you see how I have gone above it. You understand? Now I am trying to take it along with that Blex liquidum. See now what has happened. I have removed that along with the underlying bone. Now you see, let me check now. See the mass. Can you see? So what I will do now is debrider. Hey, send it for margins. Wow. Give me debrider now. I'm going to take off all that underneath. Yay. So that's the lamina papyracea. That is the region of the lacrimal sac here. You understand? Now this is the level of the maxillary sinus. You understand? So this one I have already operated. There's still bone, so no problem. That's the anterior ethmoidal artery here. Now give me a J curate. Now I'm going to take off the maxilla was also filled with pus. So I'm going to take off that. Completely. Be a little radical. Now, give me a. So you have a little fungus here also. All these could be because of radiation. And also, yeah. Give me a debrider. Debrider, please. I'm going to open up the maxillary sinus wide. Can you see the pus? So all this, see, 8 years gone in for stenosis, nothing else. We have opened it, gone in for stenosis. Even though it's a small case, as I told you, these are cases you should be able to tackle in your clinic. Do a PET scan and you try to remove it. Hey, irrigate. Good. Completely. Don't hesitate to be radical. That is the, see, that's the nasolacrimal duct. Can you see here? See the nasolacrimal duct. Can you see? Here or not? Yeah. That's why we say don't do an uncinate from that is forward. Give me a good wash. Wash. So I'm almost done with the case. Small case. Next case, you put the stapedectomy. I'm going to show a stapedectomy next. So what do you want? Post-oral staphylectomy? Okay. I'm going to show a post-oral staphylectomy live. So that's the maxilla. Give me a Blexley now. That's the sphenoid sinus. I wanted to open the maxilla and the sphenoid and also that skull base. Oh. Small residue, but immediately take action. You understand? Don't leave it and, it'll become bigger. Hey, give me up and down. Okay, I think fine. Now just pack it. So that's the end of the case. I'm coming to FaceTime now. So that's it. So it's a small case, as I told you. Yeah, my okay. Okay, as I told you, it's a small case, but then conveys some message that adenocarcinoma with a low grade post-op radiotherapy has got good prognosis. 8 years she's living. And again, we'll give her a gamma. And so I'll be coming back with the stapes live in another 15-20 minutes. And then we have a fracture nasal bone reduction. I'll show how to do that. The patient has got a septal fracture along with nasal bone fracture. Right.